As we go back to work, the primary business problem for most practices is going to be cash flow. So this is a good time to reevaluate the best way to use your software instead of, but we've always done it this way. So here are 3 changes you can make to help cash flow and collections. You can do them with virtually any Office software, and you can do them without buying anything. These are especially helpful for offices with high accounts receivables or frequent insurance processing mistakes and delays. The first change is to insist that each provider, especially the doctor, checks, corrects, prints, and signs their production report for the day before they leave the office. It's fast, it's easy, and it needs to become an ingrained habit for each and every provider, dentist and hygienist. Even with careful posting during the day, you're still going to find errors. Correct them right now while they're still fresh in your mind, before you go home. You wouldn't leave without locking the office just because you were running late. You make the necessary time. You need to make the time for this too. Otherwise, you're stealing from yourself. Employees who fail to do this are stealing from the practice. Think of it in these terms because it is literally true. This is an area where the doctor must lead. If the doctor doesn't do it, neither will the hygienist. Checking, correcting, printing, and signing this report at the end of each day will improve both your income and your cash flow. Just do it. The second change is to print all your statements first thing every morning. When I started practicing, we used to photocopy all the ledgers to mail out the statements. This was a terrible, time-consuming job we did once a month. But thankfully, things have changed. You want to run the statements each morning and have them printed and mailed through an outside service, not in the office. This is cheaper, faster, neater, and almost totally automatic when it's set up correctly. When a patient's final insurance payment is posted, if they still have a balance, they get a statement the next morning. Boom, done. The sooner the statement goes out, the sooner the patient will pay the balance. Why would you wait until the end of the month to do this? That's an old school habit held over from the days we photocopied ledgers. Time to take advantage of modern software and some updated practice habits. The third change is to create and send all claims first thing in the morning for all the procedures not yet billed. After a little cleanup, these should be only the procedures that were done yesterday. You know they're correct because each provider signed his or her production report the night before. You want to use a 2-way electronic claim service so errors get detected immediately. Your software will probably prevent you from sending an e-claim without a patient birthday, but it cannot check if that birthday is actually correct. That's the job of the 2-way insurance e-claim clearinghouse, and it should report back that error in just a few minutes. Not in a month, as if you'd sent a paper claim, or used a clearinghouse that just printed and forwarded the paper claims. You want your office tasks to be automated as much as possible. When you can, take people out of the loop so they can concentrate on more productive things like answering the phone correctly and providing first-rate customer service. Contrary to the way it's usually done, the job of sending statements and processing insurance claims should be done by the newest staff member and started on his or her second day on the job. Properly set up, it's easy, fast, very productive, and only takes about 2 minutes. Office managers spend way too much time dithering over claims and statements. Good office systems and good software automation eliminate this. Doing it this way also helps when you have the inevitable staff changes. If your systems are easy and automatic, staff transitions will be much less painful. These 3 changes, the providers checking the production report before leaving for the day, sending the statements each morning, and processing all completed procedures each morning, will make your practice more profitable and dramatically improve your cash flow as you start back to work. But remember, if you change nothing, nothing changes. If we can help you make these changes, we have consulting options starting with a do-it-yourself flavor for only $99 a month. Check out our How We Work tab on our website. Stay safe, but also stay profitable.